Bismillahirrahmanirrahim. Now, very important but overlooked thing is prescribing aspirin, 75 to 150 mg per day from 12 weeks onwards. So, which groups do we prescribe aspirin to if we look at the NICE guidelines for hypertension in pregnancy? So the first category is high risk women. The high risk women are those who have any of these five things. Who have one of five, they are labeled as high risk for preeclampsia. Now, if a woman is having a chronic kidney disease or type 1 or type 2 diabetes, or if she already has hypertension, or she has had hypertension during a previous pregnancy. So either she is chronic hypertensive or she had hypertensive in a previous pregnancy, or she's having an autoimmune disease such as SLE or antiphospholipid syndrome. Then in all these five categories, if one of these is present, all of these five conditions, then you're going to prescribe aspirin to her. But so how are you going to remember this? So you are sitting and in your clinic, and a female comes to you and for her booking or whatever, and she is already a known case of CKD, and she's chronic hypertensive, and she is also diabetic. So she has all the possible wrong comorbids, and along with that, she is also having an SLE rash. So you can just make up a story to memorize all these 5 points. Now, next category is those women who are on moderate risk scale. So in moderate risk, if more than one is present, like if two or three of these points out of six is present, then we are going to prescribe. So if it's two out of six or more than that, then if it's 1 out of 5, we prescribe. It's 2 out of 6 or more than that, we prescribe. That's very simple. Patient comes to you, she is old, she is more than 40 or above. Okay, this is unlike the risk assessment for trauma prophylaxis, in which we said age more than 35 and BMI 30 or above. Over here we say age 40 or above and BMI of 35 or more. Okay, 30 more than or equal to 35. So age more than 40 or above, age 40 or above, BMI 35 or above, and interpregnancy interval of more than 10 years, but the long interpregnancy interval. Short is also a contraindication to VBAC, but a long interpregnancy interval is an indication for aspirin. So remember that. And if in other point is also present. And then we have family history of preeclampsia and multifetal if she is having a twin pregnancy. So all of these things, if two of these six things is present, then you're going to prescribe aspirin. And what are those? So if she is a primigravida and she is pregnant with twins, are you going to prescribe aspirin? Yes. If she is a 40-year-old preemie, are you going to prescribe aspirin? Yes. Okay. If she is a female who is having her second child after 12 years and she is 45 years old, are you going to prescribe aspirin? Yes. If any of these characters are present, such that it's 2 out of 6 or more than that, then you're going to prescribe aspirin. But in case of the high risk, if any one of these is present, one of these five, then you are going to prescribe aspirin. Okay. So this is the prescription for aspirin according to the NICE guidelines, that in which conditions are you going to start it.